Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, everyone. My name is Dara Heriansa, and I am very happy to have the opportunity to share with you today about high blood pressure, uh, and how acupuncture therapy can play a role in helping to lower blood pressure. In this presentation, I will explain the definition, cause, and effect of high blood pressure, as well as general management and the use of acupuncture as an adjunctive therapy. Okay, the first, high blood pressure, hypertension, managed with acupuncture. Uh, I will explain about definition, cause, and effect of high blood pressure, pharmacological and non-pharmacological management, role of acupuncture as an adjunctive therapy. High blood pressure and management with acupuncture. We will look at the definition of hypertension, its cause and complication, standard medical management, and how acupuncture can be used as complementary therapy to support blood pressure control. High blood pressure or hypertension is condition in which a person's blood pressure remains persistently above the normal limit, usually defined as 140 per 90 or higher or repeated measurement. It is often called a silent killer because many patients do not feel any obvious symptoms, even though the risk of stroke and heart attack is already increasing. The cause of high blood pressure can be divided into two groups. First, non-modifiable factors such as advanced age and family history. Second, modifiable lifestyle factors such as excessive salt intake, obesity, lack of physical activity, smoking, alcohol consumption, and chronic stress. From the from a traditional Chinese medicine perspective, hypertension is often associated with yin-yang imbalance, especially hyperactive liver yang and deficient kidney yins. And then affect complication of high blood pressure. If high blood pressure is left under control over a long period, it can damage blood vessels and make the heart work harder. This increases the risk of stroke, heart attack, and heart failure. It can also damage the kidneys, leading to chronic kidney disease, and may affect the eyes and brain, causing vision problem and reduce cognitive function. General management of high blood pressure. Management of high blood pressure usually includes two main parts. First, pharmacological treatment, such as drugs like ACE inhibitor, beta blockers, diuretics, and calcium channel blockers. Second, lifestyle change, including a low salt diet, more vegetables and fruits, regular exercise, quitting smoking, and stress management. In addition, there are complementary therapies, and one of them is acupuncture, which can help lower blood pressure. Acupuncture for high blood pressure. Acupuncture works by stimulating specific point on the body, which can influence the nervous system, hormones, and blood flow. The goal is to balance yin-yang and regulate qi in meridians related to the liver, kidneys, and heart. Several studies have shown that after several acupuncture sessions, both systolic and diastolic blood pressure tends to decrease, especially when combined with healthy lifestyle change. Acupuncture treatment patterns. In practice, acupuncture treatment for high blood pressure is usually given 2 or 3 weeks, 2 or 3 times per week for about 6 or 8 weeks, with each session lasting around 20 or 30 minutes. After blood pressure becomes more stable, the frequency can be reduced, for example, to once per week or according to the patient condition. It is important to remember that acupuncture is not suitable for medication without medical consultation, and it should be performed by a trained acupuncturist under medical supervision. Key acupuncture point for hypertension. Some commonly used acupuncture point for hypertension include Tai Chong on the foot, Fuchi, at the elbow, Hegi, on the back of the hand, Tai Chi, at the ankle, and Nei Guan on the forearm. The points are chosen because they are related to liver, kidney, and heart function in PCM, and several studies suggest they can help lower blood pressure. Uh, for example, image of acupuncture therapy. The image on this slide shows an illustration of acupuncture point used in hypertension, as, as well as an example of patient receiving acupuncture treatment in a clinic. Fine needles are placed at points such as LP3, LP3, LI11, PC6, and TI3, while the patient sits or lies comfortably. This kind of image helps the audience understand how acupuncture is actually performed in practice. As conclusion, to conclude, high blood pressure is chronic condition that require long-term management. Acupuncture can be useful adjunctive therapy to help lower blood pressure and reduce stress, but it should always be combined with medication, lifestyle change, and medical supervision. With an integrated approach, patients with hypertension have a better chance of keeping their blood pressure within a safe range. Okay, thank you so much for I have finished the presentation. Thank you very much. Assalamualaikum warahmatullahi wabarakatuh.